Good evening, good morning, good afternoon to everyone from every part of the world you are listening to us at this moment. I welcome everyone to TWEVEC 5th webinar series. I welcome the doctors, our wonderful clients, and every other persons that join us this evening. We are so glad to have you people here. The aim of this webinar series is to create an enlightenment and public health education, educate the general public on how to improve or maintain a good health and vision status. My name is Opoyemi George, and I will be your moderator for today's session on vision care in this digital era. The topic again, vision care in this digital era. In today's digital age, people spend long hours on computers, smartphones, and other screens for work, for study, or for assignment, or for entertainment purpose. This increased screen time has led to a rise in digital eye strain or computer vision syndrome, which can cause symptoms such as dry eyes, blurred vision, headache, or causes more damage to the eyes. So in today's series, we will learn how to take proper care of our vision in this digital era. Before we begin, I would like to thank you all for taking your time to join us from different parts of the world. Now, it is my pleasure to introduce our speaker for today. Please join me to welcome Dr. Osaze Agbonlahor. Dr. Osaze, over to you, sir.
Thank you very much, Mr. Bayemi. Thank you, everyone. Good evening to you all. I'm sure you can hear me loud and clear. Good evening, good morning, good afternoon. I can see some of my respected colleagues here. Thank you so much for joining us. It's really a pleasure to have you. And also to our esteemed clients, thank you so much. And all of our friends, thank you so much for joining today's webinar. And just like the host has said, we in TWEVEC, which is an acronym for Tree Talk Vision Eye Center, we by virtue of our presence here in the FCT and in Nigeria, and also by way of our specialty, we also believe in creating public awareness, ensuring that the populace enjoys vision and vision at its best. And that is what we offer. It's not just only coming to the clinic, but knowing certain things can also help you in ensuring that your vision is properly cared for. And so in our series today, we'll be looking at this very interesting aspect of eye care that a lot of us take for granted. And also, I thank God this is a mix of every strata. I have professional colleagues here. I have friends here. I have esteemed clients here. And also even some of our students are here too. I want to put it up to every one of us that we are guilty of some of the things that we're going to be mentioning today. As an eye care practitioner, how much do you care for your eyes? In fact, as a health practitioner, let me not even narrow it down. How much do you care for your health? You see, we are guilty of some of these things, and it is good that we take charge and take note of these things and see how we can improve our vision. And so, just like our moderator have also mentioned, read some excerpts for us this evening, telling you how much will I say, challenge we are faced with as far as technology is advancing. And so it is highly needed that we care for our vision especially in times like this. So I want to especially welcome us once again to this special webinar series. This is the fifth webinar series we've had in recent times. And I want to thank you all for those of you that have been very consistent in attending. I'm sure you are really, really, you have been um, informed and also educated as far as these things are concerned. So it's a very short time, so I don't have all night to talk. I'll just dive into what we have today. So vision care in a digital era. And the content of our meeting today, there are quite a number of things I would have loved to say, but because of the want of time, we'll just limit ourselves to these four areas. So we're going to be looking at what vision care is. Some of us may have limited understanding of how to care for our vision. I'm going to throw a little bit light, on that aspect. Then we'll look at digital era and the eye. What is the effect of all of these technological advancements on the eye? Are we saying that we shouldn't advance technologically? That's not what we're saying. So I'm going to be talking a little bit about that. And also, how do we prevent, all of the woes, in quote now, all of the woes of digital era? How do we prevent it? And lastly, if per adventure you fall victim of these concerns, how then can you manage? How then can you, make sure that you live with the consequences of not taking care of your eye as you should have? And of course, there's always a way out of the tunnel. So we're still going to be looking at how to come out of it. Though we may not dwell so much on that because that's a whole lot, but I'm just going to mention a few things as a consultant. So these are the four areas that we're going to be looking at tonight because of the want of time. So let's go into it quickly. Vision care, vision care. You can see it's comprised of two words, vision and care. And in our last webinar, I was able to stress that vision and sight are two different things. All right, just to quickly reiterate, sight is an ability to see, and sight is basically the job of the eye, what you see. Yeah, all right. But vision is more of a complex, Maybe by way of my training and my special interest in eye care, I always see vision to be so complex. But it's not about how I see it, but that's the truth, that's the fact. Okay, so vision goes beyond just an ability to see, but it's about what you see, how you see it, talking about the interpretation of what is seen, and then how do you respond, accurately to what is being seen. That's what vision is about, and you must ensure that you have all of these areas in check. If by virtue or by chance an area is lacking, then you cannot claim to have good vision. And so when you talk about vision care, it talks about that whole complex process. How do you care for it, especially as it comes to this digital age as we are in now? So I'll limit myself to how you care for vision, within this context as it concerns our topic, because there are quite a number of things, quite a number of care you give to your eyes or to your vision, depending on the context we are looking at it from. So I'm looking at it from the context of vision or of the digital era that we are in today. So you already know what vision is. So what is vision care? I just put up this to try and explain it, in words. It's quite deeper than this, but just to have, because we need to break it down, to bring it as plain as possible. So that's why I put up this definition. So we call it a comprehensive set of services that is focused on eye and vision health. So you see, eye and vision are actually, highlighted there because it's a point of reference. You must be able to understand the difference between them. I, I can take care of my eye, but am I also taking care of my vision? Or perhaps I can take care of my sight. Yes, I can see, I have very clear vision at distance. But that clear vision, is it comfortable for you? Are you sure you're comfortable with it? And so every eye care practitioner doesn't just make sure that his or her patient or client sees clear. No, that's not where we stop. We ensure that that clear vision you have is comfortable for you. And so you can see clearly, all right, but you don't have headaches with the clear vision. You don't have strain with the clear vision. Your eyes don't burn out. Your eyes don't tear, and all of those things. So that's where that's one of the areas we are concerned with. Okay, so it's not just all about seeing. So all of the services that is focused on eye and vision health, which of course includes regular or routine eye exams, this is one area that we as Nigerians or as let's say as black men, we really fault in. All right, eye exams, periodic eye exams. If you are an eye care practitioner here, have you checked your eyes the last 6, 7, 1 year, even 2 years? I won't be shocked if I have a few of us here that have not done that. So you see that it ropes all of us in. It also involves diagnosis as well as treatment of eye diseases. This is also part of vision care. And most importantly, I consider this very, very important. Prevention of the causal factors, prevention. And this is where I, this, this may be the hallmark of tonight's presentation, because that is what this whole process is about, to know how to prevent some of these things before it becomes a problem. All right, so that is one area. So in summary, once again, vision care is a comprehensive set of services focused on eye and health, eye and vision health, which includes eye exams, diagnosis, and treatment of eye disease, as well as prevention of the causal factors. Um, there are quite a number of preventable causes of blindness, right, that we should be aware of, although it's not within the context of tonight's presentation, but I just need to mention that, okay? In fact, the number one leading cause of blindness today in the world is actually preventable. It's something you could prevent, and that is cataract. Although at some point in life, when one is aging, you may not be able to avoid it, all right? But there are certain things you can do to prevent it. For example, trauma to the eye can lead to instant or sudden coming up of cataract. And so it's something you could avoid. You could stay away from anything traumatic, all right? Physically now, not emotional trauma. Someone will say, I'm emotionally traumatized. Will I have cataract? Please don't ask that question. All right, that's by the way anyway. So that's what vision care is about, okay? And there are levels of vision care that you should be aware of. If you see your slide, if you see what is on the screen, you will see that preventive is higher. Why? Because I have a master's in public health, and I understand that if you prevent these things, from coming, you save a whole lot. Okay, there's less economic burden, there's less, strain and trouble, and even there's less of loss of functionality as far as that organ is concerned. Because there are certain conditions, there are certain eye diseases that you end up having, and it will either lead to loss of function or reduced functionality of that part of the body. And so it's best to prevent it. Let's take an example. Let me use a general health, for example. If one prevents diabetes, maybe you live a lifestyle that you are not prone. You make sure that you live a lifestyle that does not in any way suggests that you have diabetes in future, maybe you do regular workouts, you make sure you watch your meals, you eat balanced diets and all of that. You're just very conscious of that, okay? And someone that does not, maybe not concerned and ends up having diabetes. Now, you may still live longer if you address it, if you meet the right care, you meet the right health practitioner that will provide care for you. But you will see that there are certain things you can't do anymore. There are certain foods you can't eat anymore. You have just, giving yourself that boundary. And most of the time, life expectancy at that stage is also lower compared to when you don't have it, compared to when you prevented it from the beginning. You see, so preventive care should be one of the areas we should emphasize on as practitioners, as healthcare practitioners. And as for those of you that are not health practitioners, you can also do your job. You can also be part of this, because this is a collaborative thing. It's not only for us that are healthcare practitioners to, resound this in the ears of people. We owe this duty to ourselves. We are responsible, to ensure that every man, every woman, boy, girl around you knows how to prevent diseases generally. And so that is why you see that the preventive level of vision care is usually, should, though not necessarily being highlighted, we always wait until there's a problem. And it's a typical mindset of, let me say, a Nigerian or a black man. We wait until the problem has come, then we start running helter-skelter. That should not be. So there's a responsibility on all of us, and that's one of the major reasons why this webinar series is carried out, to ensure that you share this gospel, share this good news. Okay, so that's the first one that I will mention, and I said you and I are responsible for this. Then you move from there to primary health, to the primary level, which is where you have health centers around you. They address minor, health challenges, and if at the end of the day, whatever you bring is beyond their ability, they take you to the secondary level of care, which is what you have in general hospitals. See, sometimes your primary healthcare centers can't address certain conditions. They send you to Asokoro, for those of us are living in Abuja here, or they send you to Kuba General Hospital, or they send you to Maitama General Hospital, and all of that. Okay, but there are certain conditions that even the secondary level of care can't address, and they have to send you, to tertiary level of care. This is where you now have very high specialized form of care. Okay, so this is where you now meet the people that are specific, with that condition, and they are able to address it. But you don't need to get up to that level if you can, make sure that the first level is you are operating fully on the preventive level. All right, so I think I'll dwell there enough. Let's quickly move forward to the next. So let's talk briefly about digital era and the eye. The truth is that every one of us enjoys digitalization. We want things to move as quick as we want them, especially the age we are in right now, where it's no longer Gen Z anymore. I hear it's now Gen Alpha, where things move with with laser speed. We don't want to work anymore. An average young man or young woman don't want to work anymore. You just want to sit at home, press your computer, press your phone, and make your money. That's the era we are in today. So there's rapid technological advancement. There's quite a number, and it's good because we can't go back to the Stone Age where, things are more difficult to do. Today now, I'm using technology to talk to people all over the world. Anybody in the world having this link can click, and that's it. Just with a click of the button, you are all over the world. Okay, you can hear anything from anywhere. This is technology, and it is good. It has its benefits, no doubt about that. However, every good thing has its demerits. I must be concerned about that. Sometime in 2019, I think I've said this countless times, I did a study on computer vision syndrome, which is one of the things we're going to be looking at tonight. And as of then, that was pre before the lockdown, before the COVID-19 lockdown. And as at then, the prevalence of CVS, which is computer vision syndrome, from that study was about 65%. That's a whooping high number. And I'm sure, very, very sure, the last time I checked, if we do this study again now, I'm sure that we're going to be having nothing less than 90 to 95%. That means that 90 to 95% of any computer user may likely come down with computer vision syndrome. All right. However, we can reduce that number. There's a way we can still make use of this technology, enjoy its benefits, and this prevalence, this rate of problems we have can still reduce or can still may not necessarily increase. It's possible because there are things we can do to avert the woes or the demerits of this advancement in technology. And so I've said that there's rapid technological advancement in this era. There's ease of doing work, of doing any task in this era, but we overuse it, okay? And that's one of the things we're going to be looking at as one of the ways. Today in schools, children are told to do assignments online. They stare at the screen almost all day because when they are in school, in fact, some students, I was kind of embarrassed one time when I was seeing a patient, a client, and I asked, as usual, okay, you can't see the board, okay? I asked, is it, I thought it was just whiteboard, back then that they used. And the child said, it's a smart board. Oh, so you use smart board in school. You see, and these smart boards obviously have some rays that it emits. And so throughout the day when they are in school, they use the smart board. And when they come home, maybe have a few naps, they stare at screens, maybe a TV set, or sometimes their phones, their tablets, they have to do assignments, they use the computer at home, and all of that. So you see, almost all through the day when they are active, they are staring on screens. That is a danger, and that's overusage of that digital device. And so most likely, anyone that have such level of usage of these digital devices will most likely come down with digital eye strain. And what is digital eye strain? It's the same thing as what we call computer vision syndrome. And I would just, this definition here also just try to summarize what it is. It's a deep, and a very broad aspect of eye care that 60 to 70, or let me just say 60 to 90% of computer users who are not conscious, of health of who are not conscious of some of these techniques to minimize this, the outcome of this problem will definitely come down with it. All right. So computer vision syndrome simply is a myriad, it's a matrix, it's a complex of all symptoms and signs associated with computer use or with screen use. Okay, so, and of course, it is both visual and non-visual. That's both ocular and non-ocular. Because there are sometimes, most of them usually complain of neck pain, they will complain of shoulder pain, some waist pain, some back pain, because they are not, they are using the system, yes, yet it's not giving them ocular symptoms, but it's giving them non-ocular symptoms. That is also computer vision syndrome. All right. So, but we're going to be focusing on the ocular aspect because we are dealing with the eye. And even at that, I will still definitely chip in one or two other ways we can avoid the non-ocular signs and symptoms that is associated with computer or screen use. So let's dive into some of these the tips, which is prevention. I just want to check the time. All right, so we'll still have some time. So I'll be stopping because I know we have quite a few questions and concerns or even contributions from some of our respected colleagues that are here. So what are the prevention tips? It is also this is an area that is inexhaustive, but we're just going to mention a few of them. I deliberately put this so that I don't rush, okay, and I will end a good time so that we can ask our questions if there are any. We must take note that overusage, so there's a popular saying that when you overuse something, if you overuse it, it will definitely suffer from wear and tear. And that's exactly what happens to your eyes when you don't take breaks, when you don't have time to relax. And so this rule, the 20-20-20 rule, this is not new to a lot of us here. You must have heard of it before. It has been proven to help you and I that are always on screens. Okay, it has been proven to help you and I that are always on digital devices. So what does the 20-20-20 rule talk about? It's simple. It says that for every 20 minutes you stare at a screen, with intentionality, look away from that screen 20 feet away from you. That is very significant because when you look at 20 feet away from you, it helps the eye to relax, right? When you look at things at near, the eye is engaged. There's what we call accommodation that takes place anytime you look at near objects. So it's not just about looking away from the screen and you're still looking at a near object. The eye will not relax at that point. So you take your eye away from the screen every 20 minutes to a distant object 20 feet away from you for 20 seconds. So 20-20-20 rule. Every 20 minutes, look away from your screen 20 feet away from you for 20 seconds. I have not seen, although it's possible for very, very meticulous people that try to do this. But I know that a lot of people may have challenge using this prevention tip. One of the reasons is forgetfulness. It's possible that you may be so engrossed with work and you may lose track of 20 minutes, okay? It's possible because I have tried to see how I can do that, but I have some very unique obstacles to maintaining that. So it's really difficult to do this. Another challenge or constraint some of us may have is how do you look at, is your office so big that you can have 20 feet, distance, except you're walking by the side of a window where you can just look away and focus, somewhere very far. But most of the offices you and I know it's covered, air conditioned, the blinds are there. So you see yourself, in an enclosed place. You see, so there are a lot of challenges, with this particular rule. However, it is one of those ways that you can help yourself. You can prevent some of the woes that not some now, to be very exact, CVS, computer vision syndrome, or digital eye strain, as I mentioned earlier. So 20-20 rule can be one of the ways you prevent it. If you want to really help yourself, today we have watches, we have timers on phones, even your screen. We have AI apps that can help you remember this rule. So this is one of the advantages of technology too. So you can download AI apps that can help you, remind you of this. You can set alarms, you can set timers to help you remember, particularly when you know you're going to be engrossed with work. Okay, and try also to have time to sit up or create that distance where you can actually focus on, even if you cannot get up to 20 feet, but just find a way to look at the distance. That will really help to minimize this condition. Another thing you need to do also, another tip is blinking regularly. This is very, very difficult, trust me, because I cannot see or I cannot imagine you watching. In fact, this is science. It has been proven with studies. There are studies, quite a number of studies that have compared two persons, okay, people that are watching a screen, maybe watching a movie, playing a game, or working, and those that are not. Studies have shown that those that are on screens, they blink less. Okay, they blink less. You should blink nothing less than 15 to 20 times per minute. That's like an average, the standard. But you see some persons in a minute, they blink 3, 4, 5 times because they are staring, maybe enjoying whatever they are watching. So studies have proven that when you're on screen, you blink less. And so there's need for you to be conscious or to be intentional about blinking very frequently. What does blinking do? Blinking regularly or blinking in itself just helps to replenish the ocular surface. When you blink, you create a new tear film all over the ocular surface. Ask yourself when you stare, after some time your eye hurts or there's this burning or peppery sensation that you feel because the ocular surface is becoming dry. And so you have that urge to quickly blink. That's the advantage of blinking. So when you blink very regularly, you replenish the ocular surface, and it helps prevent some of those conditions or some of those signs and symptoms that you see with digital eye strain or those myriad of problems associated with computer use. Another thing you should also do, this is one area I also advocate, because obviously there are certain things you cannot avoid. In fact, when I see some children and their parents are here and I counsel them, they will say, they will take that tab from the child or they will take that phone from the child. I said, that's not the solution. Okay, you take the phone, and if they give them assignments from school and it's something they have to use the phone for or they have to use the system for, what do you then do? You will see hand it over to them. So it's not yes, there's a place of reducing interaction with these things, but there are points or there are times where you can't help but to use it. And so when you want to use it, you have to wear some protective measure. It's just like people saying there are some persons that work on Ebola, they work on COVID, they work on HIV. When you see them in the lab doing these things, they are always with protective gears over them. All right. So yes, they know that whatever substance they are holding has its disadvantage or is dangerous to their health, but they go in there and they still pick it. You see? So they do that because of the confidence they have with what they are wearing. And so it is advised that anytime you are looking at screens, have some protective measure on. And there are quite a number of them out there in the market. I'm not here to mention, to advertise any, but there are quite a number of them. Okay, so you have one of the most popular ones out there is your blue blockers. I will say something about that much later. Okay, there are Polaroid lenses. There are even computer vision, lenses. There are computer lenses that are specific for the screens. And what they do is that they help to reduce the amount of light that comes from the screen and also help to cut out some of the dangerous rays that comes out from the screen. And so the last, which I will talk about today because of our time, is the proper work ergonomics. This is very, very important as well because we pay less attention to this. If you are here and you usually have come down with back pain, neck pain, and all of those pains because of your work in the office, please check your work ergonomics. And what does work ergonomics talk about? Number one, lighting of your environment. How is your lighting? Is it okay? How is your sitting position? How is your posture when you're working? Right? There are specifics. If you want to have less challenge with your with your shoulder, your neck, your waist, and all of that. There's a position you sit. There's a way the chair's height and the table's height, there's a standard. All right, I would have brought that. There's a picture that actually depicts that, and that would have been part of my slide. But they are everywhere in the internet. Okay? You could just check for proper working position and it will pop up. All right. So usually you don't, if you're looking at a screen, your screen should not be above you. You shouldn't stare at the screen up this way. All right. The ideal thing is that the screen should be at your eye level or slightly below, not even too far from, too far below, slightly below, maybe 10 degrees down from your line of sight. Okay, so you just look straight at the screen and you look at that, and you are sitting upright. Your chair should be, the back of your chair should be, straight at right angle with your knee. Okay, I mean your femur, the way you sit down. There's an actual position that you should have. Not when you are lying down looking at screen. Yes, sometimes because of leisure, we want to take very proper or very relaxing posture, or sometimes they have effect on our health, and so we must have proper work ergonomics. That's not the point, but it's just one of those tips. So take note, ensure that you don't you have a proper working station. If you are always on screens, if you are a secretary, or you are an office person that is always on screens, you must ensure that your chair is not the one that you relax like this, or the one that is pushing through. You must be straight ahead, sitting upright, chest out, and you're working. Okay, so these are the tips. And I want to mention this before I close or before I stop tonight, so I can entertain questions. We hear of blue light, and all of that. So I just want to explain something to us. Yes, like you're seeing in my screen now, on your screen, you will see that white light has component colors. Okay, so you have your ROID, that's your rainbow colors in white light. And so the question will be, what white light, is it dangerous? Well, it is not dangerous. It is a component of the white light that seems to be dangerous when you expose yourself to it for a long time. All right, and that's the blue part of the white light. So if you look at every digital screen now, not windscreen in your car, every digital screen, open the back of that screen. What is there is your LED, is white light, is it? All right. So the white light, as it goes into your eyes, or as you look at that screen, you're basically looking at white light. And so when that white light goes or is divided into its component colors, you will see that the blue part of it, from the diagram you're seeing, look at this area here. You can see my cursor. Sorry, you can see my cursor. This is visible light. So what you have here, we'll call it the electromagnetic spectrum. There are certain rays that we don't see, that are invisible to our eyes, but they are very dangerous as well. Some are dangerous, some are not. Okay, starting from those with very, very high wavelengths. The higher the wavelengths, the lesser the energy. That's physics now. I don't want to bog our mind with those jargons. Okay, so like your radio waves, microwaves, infrared waves, these are non-visible but safe rays. They are all in our atmosphere. They are right there with you in your room, especially radio waves, okay, and infrared. If you're using a remote, these are infrared rays that go, to do what you want them to do, but without harming you. Then after that, you now have the visible light, which is a white light. Then going down in terms of wavelength, you have ultraviolet rays. These are they are harmful rays anyways, okay, with constant exposure. It's found mainly in the sun. Okay, then you now go to X-rays. X-rays, you and I know that if you have done an X-ray, your doctor will advise you don't do more than twice a year. Then, of course, gamma rays. This one passes through tissues. They penetrate through tissues. So this is where you now talk about your lasers and all of that. So you can see that these rays going down from here are quite dangerous. Now, if you look at this visible light, which is white light, it's the visible one that we can see. When it's separated into its component colors, it goes from red down to, I think this is purple or indigo, okay, or violet, I'm not sure. They all have the same hue. So if you see, violet and blue are closest to this ultraviolet ray, which is dangerous. And so that is why you hear this uh, campaign of blue light, blue light, blue light. This is the reason why. I just needed to bring it up to you so that you would understand why there's a campaign against blue light, and some persons take the advantage to market blue light blockers for their clients. All right, but studies have actually shown that whether you wear blue light or not, or you use regular light, there's minimal effect. However, with these signs that have been proven, you see that it is advisable you use it because it helps to cut out the dangerous blue light that you can be exposed to, which obviously over time, you may not find the effect right away, but over time, on long-term use or long-term exposure, that is when you can see some effects. Studies have actually shown that long-term effect of these blue lights, or UV light, can lead to macular degenerations, it can even lead to cataracts and all of that. So it is advisable that you protect yourself from it. So if your doctor advises you to get a blue blocker, don't argue, get one and be safe. Lastly, how do you manage? Like I said, this is quite a lot, but I'll just, in few minutes, so that I can stop, tell you how you manage it. It's basically managing the symptoms, because a computer vision syndrome patient, when they come, they complain of blurriness sometimes, they complain of headaches, they complain of dry eyes, they complain of peppery sensation, they complain of eye pain. These are ocular conditions or ocular concerns. They also complain of non-ocular concerns, which may be headaches, back pain, shoulder pain, and all of that. So what you do is you are talking about management now, not prevention. Explain how you prevent. Now with managing. So this has to be done by a specialist, by an optometrist, okay, by your doctor, your eye doctor, an optometrist, okay, or whoever you have in mind that can give you the necessary help. Okay, so what we do basically is we manage the symptoms and the signs we see. That's what we do. So if you come down with some of these conditions, try as much as you can. Since it has come to the level of management now, you have to find the closest, healthcare practitioner to you and meet them. What we basically do is manage the symptoms. And then, of course, when the symptoms have been alleviated, we now ensure that you take some of these preventive tips and apply them going forward. So some of the symptoms we manage would be, oh, my eyes are peppery. Okay, then we can now do what we call dry eye exam for you. That's the whole process in itself. So we check we check your tear functioning, your tear quality, your tear quantity. We try to find out what's causing this. Oh, you have stared for too long. The glands that are supposed to be secreting are not secreting as they should. So we start, helping you with either with medications or some form of therapy like warm compress to see how we help those glands to start secreting their content again. Okay. Sometimes the signs are red eyes, sometimes swollen eyes. We of course manage those signs. We either manage them with medications, just like I mentioned. There's some medications we give to ensure that these signs or the symptoms are alleviated, or sometimes we also give spectacles because blurriness, when your vision is blurry, it may be due to some of these refractive conditions. Because refractive conditions can also be induced. Studies have shown that when you are always at near, particularly for children, you're always at near reading, or playing games or doing some form of near work constantly, they are highly at risk, to developing what we call myopia. or short-sightedness. And so if that's the case for that individual, spectacles can be prescribed, for such case. All right, so I think I will stop here tonight because of our time so that we can ask questions. This is a very, very, you can visit our website. We do lots of educative posts there. Some of you receive our messages every week. I want to thank you for listening and looking at them. Click on them and you will not regret it. So I will give the floor to the moderator again as he continues that. Thank you very much. If you have questions, contributions, please, you can come up with them. Thank you very much.
Thank you very much, Dr. Osaze, for that educative presentation. I'm very sure everyone has gained one or two useful information. For me, I've gained some education on this particular presentation. I've learned that there's a difference between eyes, sight, and vision, and also learned about the 20-20-20 rules. For every 20 minutes, you look 20 feet away for 20 seconds. And as simple as blinking is, I also learned that it is very, very good for us. So I believe every one of us too has learned one or two things, because we are all guilty one way or the other of all these things. So it is time for question and answer. If there's any question, any additions, or anything that we
yes, I can see one of my colleagues here, Dr. Njezi, my chairman, sir. Good evening, sir. Thank you for joining. Please, you have the floor. Your hands are raised.
Dr. Osaze, thank you very much. I do have a question. I just want to thank you for this wonderful public health enlightenment. This information is very crucial at this point. You are complaining of time. We have one night. I wish you had deepened this conversation. There are so many areas I know you would have touched. Maybe there will be a part two. I just want to say thank you very much. I'm very happy that I was part of this class. Thank you, sir.
Thank you so much, sir. I appreciate you, sir. Thank you. Okay, Dr. Priscilla, please, your hands are up. You have the floor.
Thank you. Yeah. Yes. Good evening, Dr. Osaze. Good evening, everyone. That was a wonderful presentation. Although I had some network glitches, but the part I listened to was very, very interesting. Well done. More grace to your elbow.
Thank you so much.
I just want to add that our fight against avoidable blindness in Nigeria is actually digital eye strain is forming another formidable group of avoidable blindness in the near future. I did a survey, in Nigeria, and I discovered that an average Nigerian between the age of 18 to 40 spend over 6 hours on their smartphones and various digital display units. And for people who spend more than 2 hours every day on their phone had one form or the other of a dry eye symptom. So this is a very timely topic, and as optometrists, we should position ourselves on the front line to fight against avoidable blindness from this criteria. Also, I want to bring to our knowledge that some countries have started taking proactive steps to prevent the consequences of these. We know the effect of digital devices on myopia, for example. By 2050, half of the world is going to be myopic. And the use of digital screens, in addition to other factors, have been implicated. So in a country like North Korea, for example, recently, they banned the use of smartphones in their schools or smart devices in, I think, from kindergarten to a certain age. I can't quote that exactly now, but we can Google it up. They banned it because it can affect the eyes. And then in Singapore now, they've added to the 20-20-20 rule. They've added 20-20-20, then 2. They added a 2 to it, that children must be allowed to go outdoor to play for at least 2 hours in a bid to reduce myopia and also digital eye strain being an associated risk factor. So as optometrists, there's a lot we can do. I'm an advocate for the eradication of avoidable blindness in Nigeria. And with all I seize every opportunity to get people to be aware of what they can do. And as optometrists, I want to encourage every one of us. We're on the front line of this fight. Ophthalmologist is not coming to drag this with you. It's your game. So thank you very much, Dr. Osaze. Together we can fight avoidable blindness in Nigeria. And 2050 is just here. Add 25 years to your age. Where will you be? So it's on us. It's on our children. It's on our grandchildren. Let's do the most that we can. Thank you very much.
Thank you so much, Dr. Priscilla Imade. Really appreciate it. In fact, one of the recommendations from WHO is that children between 0 to 2 years should have no screen time because of some of these, catastrophe that may happen in the future. So I want to align with what is happening in Korea, in North Korea, like you mentioned. Is it not in South Korea, you said? In fact, to also add to that, just to also try to fight, some of these, particularly myopia, development and progression, because it's highest in the Asian world. In fact, right now their classrooms are made of glass. It's no longer the four-walled room. It's glass, so that children can have, view of distance, because near work has been strongly associated with that development and progression. So thank you so much for that addition, man. Really, really appreciate it. My AFCO president is here. Thank you so much, Dr. Osaze. I can see your hand up. It's a privilege to have this big fish in this meeting. Thank you so much, sir. I appreciate you. Please, sir, your comments and your words of wisdom.
All right, thank you so much, Dr. Osaze. I want to especially appreciate you and to commend you for this your regular podcast engagement. Thank you so much. And of course, let me also appreciate my chairman. I'm speaking from your territory, and I want to appreciate you also for being here. I want us to understand that this is just the beginning of anything digital. The world is going completely digital. And the more we are aware of the fact that this is going to continue to be a growing concern, the more prepared we become. In your presentation, I didn't even hear you talk about the fact that we now have screens even in front of us in the vehicles. In those days, it was, those TV screens for children to watch, but now you have monitors in front of most vehicles. So it means that our world is completely going digital. And everything that we do must be centered around that. So education for us as frontliners is key. And we must begin to bring to the knowledge of, policymakers and the general public of this growing concern. You would also realize that even your education now is done digitally. It crossed my mind a few weeks ago when I wanted to talk about something that had to do with less use of less digital time. And I realized that the only platform I'm going to have is to post it, on social media, to get it across to the public. So our world has left physical. You now have ebooks. Now you don't read books again, physically. You read books electronically. And everything that we do now, post office has been shut down because we read our mails online. In short, our world is going online. And so we must understand that whilst we as eye care practitioners see the need for continuous education, we must prepare our mind to the fact that this is not going to change anytime soon. Yes, there are laws coming up in different countries to reduce the onset of the use of these devices, just as the last contributor has made, 0 to 2 years being banned from using, any digital device. It still doesn't eliminate the fact that the rest of us depend entirely on digital devices for our day-to-day living. In times past, you and I were walking to the bank to make transactions. Now we do it on our devices. We come home, it is the first thing we do is to sit in front of the screen. You would also understand that it's even there's now smart homes. Smart homes now rely on digital devices to be able to, tell you what you're going to do. So it is going to continue to happen, even in our practices. We use probes now to do surgeries. That you have specialists doing laparoscopy now is done with devices. Surgeries are now going to be done with robotics, all of them viewing from the screen. Yes, we need to get prepared, and we must begin to educate the public on this. It's a growing concern. It's not going to end suddenly. Nigeria is not, I would want to say that Nigeria is not behind in terms of awareness creation. We are doing greatly well compared to some other countries who are just beginning to welcome or embrace digitalization. But every one of us in our respective offices, even you in your clinics, you now realize that your autoref is purely digital, your lensometer is digital, everything is going digital. And I want to take this home finally as I land on this point. We as eye care professionals, for as long as we keep educating the public, let us also learn to educate ourselves. Because physicians, like the Bible says, physician, heal thyself. We must also understand that our devices are becoming very digital, and we must also preach this message to ourselves in-house. Once again, I commend you for the wonderful job you are doing, and thank you so much.
Thank you so much. Thank you so much, my president. I really, really appreciate these words. It's really, it's a big one for me coming from you, and I know that one day, someday, the preparedness will be top notch as far as this advocacy continues. We'll keep doing our bit, and we'll keep ensuring that the public is educated. Yes, we can't stop the growing trend. Obviously, we can't. But the only problem is if we're not prepared, it's going to end up in a very, very catastrophic. In fact, right now we are already in a pandemic. If we can, visual pandemic as concerns some of these technological advancements. But we must be prepared, and I'm sure that we are up to the task. And just like you said, policymakers, thank God for the likes of you that are in positions to help some of these things scale through. I know at some point there was a committee on photonics, something that you were really, really involved in at some point. And some of these things coming into the country should also have a way of being regulated. As the inventors, I'm making these devices. I know that some of these devices have eye care in them, just to see how some of these effects are reduced. But more still needs to be done, because the screen in itself, from studies have shown that looking at screens in itself, because they are all made up of pixels, and it's much more, studies have actually shown that staring on screens and staring on hard prints, you strain more when you stare on screens, because screens are made up of pixels and those things blur out at the edges. So you focus more on screens compared to hard prints. And all of these things put together, that's why we need knowledge as well as skill when it concerns making these equipment, so that it comes out and the woes are less compared to when none of these things are included. Yes, sir. Thank you so much, sir, for that addition. Do we have any other comments? If not, I would hand over to the moderator so it closes us for tonight. Thank you, everyone, for joining. It's already 7 p.m.
Dr. Osaze, thank you very much.
Thank you.
God bless you, Dr. Osaze.
Thank you too, ma. Thank you, ma.
I'm happy for what you're doing. The Lord strengthen you the more in Jesus' name.
Amen.
Thank you for filling in the gap for us. The Lord increase you more and more.
Yeah,
and I
thank
want
you
to
so much,
commend you
Dr.
for the
Osaze.
time you're spending.
Hello.
Spending preparing this podcast. I want to commend you so much. God bless you.
Thank you so much.
We do not take it for granted.
Thank you so much, Dr. Osaze.
Yes, sir. Dr. Kingsley, thank you so much, my VP.
Yeah, with your permission, I will onboard most of my members around so that they'll benefit from this your noble course. I sent you one number earlier, but I think it was late. So I will co-opt others with your permission so that they will always be part of this program.
It would be a pleasure. It would be a great pleasure, sir. Thank you so much.
Right. Thank you so much. God bless you.
Thank you so much.
Thank you, Dr. Osaze. Thank you so much.
Dr.
It was
Princess.
very insightful. Thank you so much.
Thank you.
Thank you.
Thank you, everyone. I appreciate you all.
Thank you.
Thank you. Thank you so much.
Thank you.
All right,
Thank
over
you
to you, Dr. Okay.
Hello?
Thank you. Thank you so much, ma'am.
Yeah, thank you.
Thank you so much.
Thank you for enlightening people like us.
Thank you too. Thank you for listening.
All right.
All right. Thank you all for those great questions and all the contributions. Special thanks to the doctor in the house for their contributions. And we also thank Dr. Osaze for the clear and insightful answers to all the questions. As we wrap up, we'd like to thank everyone that joined us today. We hope you found this section valuable and inspiring. And likewise, we like to tell you that we like to inform you that you await, and we would like to inform you that our next webinar series will come up next month. So the 6th edition of our webinar series. So just be awaiting. And then we would like to introduce our TVEC WhatsApp community. This is where we share educational posts. Please do well to visit to learn more pertaining to our eyes and vision. Thank you all for joining. And this comes to the end of today's session. Good night.
Good night, everyone.
Good night. Good night, ma'am. Good night, everyone. Thank you for joining. God bless you all.
Good night, everyone.
Good night. Thank you for joining.
Dr. Osaze, good night.
Thank you so much. Good night.
Bye. Bye. Bye.
Bye. Bye.
Thank you, Doc.
Thank you, Dr. Princess.
My forever mentor.
I will be with tea.
Thank you so much, Dr. Osaze.
Thank you.
For an awesome presentation.
Thank you so much. I appreciate you, man.